Welcome back to Insight. We're at Indiana Physical Therapy here, and we're talking to Ben, and this is an important category if you're planning on surgery soon, of pre-operative physical therapy.
Yep. I think something maybe not as well thought of is, coming in and having physical therapy before you actually have your surgery. It's common with, knee replacements or hip replacements, or even with, people who have an ACL injury or tear.
So what are the advantages? Is it going to help my recovery, I'm assuming?
That would be the plan. If we take the example of the ACL again, we found that results were a little better if instead of doing surgery right away, we waited a little bit, let things calm down, the swelling to come down, build some strength, get the range of motion back, and then have surgery maybe a month later instead of having it right away. The results were better. And we find that same thing with, hips or knees. People come in, have some physical therapy, gain some strength, gain some range of motion, and that helps them recover a little quicker.
Not that this is something that I'm guessing you see often, but do you occasionally, once you've got everything settled down, maybe you don't even need the surgery?
I think some of those cases where some people are maybe a little bit, on the fence whether they should have it or not, that, yeah, there are some cases that, maybe they delay that surgery a little bit later, or, can push it back where they don't need it, at some point, yeah.
So are these things that surgeons are suggesting? Or, I mean, a lot of times you don't even see the surgeon until maybe the day before the surgery to begin with.
Yeah, we do get referrals from surgeons. Maybe, we get a visit or two for a home exercise program before their surgery. So definitely there are some surgeons that will refer people here, and then some people just, have heard about it and they'll come in and desire, maybe some exercises or some range of motion things prior to having their surgery.
So obviously, having you guys help me before surgery, I'm assuming then it would be wise for you to see you guys again after surgery too then.
Oh, we would love to see the person back, afterwards. So, again, we've built a relationship. We know the person, know their surgery. Maybe even through that process help them prepare for what it's going to be like after their surgery. So I find that a lot of times people desire to come back as well afterwards.
So how many sessions ahead of time, or how long out ahead of time are we talking usually?
And I think it's a little bit dependent upon what, what is being, we're seeing them for. I've had surgeons refer people for like a one-time visit, home exercise program. So it can be as short as a one-time visit. Sometimes that might be 2 or 3 visits over a course of a couple weeks. With an ACL injury, it might be a month, something like that. But anywhere from, one visit to, a month of therapy.
A lot of times, I guess I'm thinking this through, is if I know I'm getting surgery, that part of me is probably in a lot of pain, or at least, could be in a lot of pain if I do something wrong. How important, I guess, is, going to somebody who knows what they're doing so that I'm not re-injuring myself every time you've got me on an exercise program?
Yep, and that's where we'll help. Help guide you through, what exercises are appropriate, which ones, might we hold off a little bit later, or maybe until after surgery when you've recovered. So, yeah, we can definitely help that person navigate, what is right, what is wrong through that process before surgery.
Hopefully, pain is never a part of physical therapy, right? I mean, that's the goal.
The goal, yeah, I guess pain of injury is something we want to try to avoid, but, I'm not saying that some things aren't a little uncomfortable, but yeah, we definitely try not to make anything worse. So that's where we come in to help with that, yep.
So if somebody wants more information, should they talk to their surgeon or their doctor first, or is this one of those, again, obviously with direct access, they can come see you first? Yep,
they can choose whichever way they want to. They can discuss it with their surgeon. I think that's a good thing, just to let the surgeon know, what they might be planning to do. But, if they desire it, then yeah, for sure they can come in direct access and see us, and we can help them.
And so once you get to that point, IndianaPT.com, a great website, and 14 plus locations here in the area?
I think 16.
16, there we go. The number's always growing. At Indiana Physical Therapy, find them online. We'll be right back on Insight.